Hello, Mr. Kapoor. So you've got Adit today. So Adit is your nephew, is it?
Yes, sir.
Okay. So tell me, what is the problem with Adit?
Sir, he's been having very frequent bouts of cough, cold, and fever.
Okay. So he's 4 years old, right?
Yes, sir.
So since when is he having these problems?
So since 2 to 3 years now, sir.
Oh, that long.
Yes.
Okay. So when you say he has frequent cough, cold, and fever, out of these three things, what is his main or the most prominent complaint?
So the cough, it is very bad, sir, and it is very long time, sir. It takes to settle.
Okay. So suppose there is an episode of fever, cold, cough. Can you tell me in one episode how does it start? How does it progress?
So it starts with a cold and running nose and sneezing. Then he starts coughing and fever bhi aa jata hai. He gets fever.
Okay. So then how long does all this last?
So we take him to our family physician, he gives medicines, but still it takes around 10-15 days to get better. And no sooner is he better, within 15-20 days again a bout comes and we have to repeat the whole thing.
Okay. And is the fever very high?
No sir, 9900, mild fever sir.
Okay, okay. And you said he gets repeated such episodes. So roughly when did it start?
So it started 2 to 3 years back.
Okay. And suppose he has had 10 such episodes. So each time there is fever?
No sir, no. Out of 10, 3-4 times he's had fever.
Okay, okay. Fine. Now this cough, is it more at one particular time of the day or is it throughout?
He coughs through the day sir, but it is especially worse at night and early morning sir.
Okay, so night means once he goes to sleep?
Yeah, middle of the night sir.
Okay, okay. And what about other problems? So does he have any skin problems?
No sir, no, not that I know of. But his father has sinus problems sir.
Okay, okay. And he was born full 9 months?
Yes sir, yes.
Okay. And his weight was also normal at that time?
Around 3 kgs sir it was.
Otherwise, in general, he has been keeping good health.
It is sir, but initially he used to have these coughing bouts once in 2 months. But of lately we are seeing that every month it is happening, every month it is happening.
Okay, okay. And all his vaccines and all have been done?
Yes.
Fine. Let me check and then we'll discuss what it is. Friends, I am Dr. Rajesh Chokhani, a general pediatrician from Bandra, and now we will analyze this interaction with this patient about cough. So the first thing is to determine whether cough is the chief complaint. So here this patient had multiple complaints, and on asking it was confirmed that cough is the chief complaint and it is quite significant. So our interpretation is that it is an airway disease. Whenever cough is the chief complaint, we must also ask about past history of repeated coughs, which in this case is definitely there, which is highly suggestive of a reactive airway disease or asthma. Once we have that, the third question to ask is about personal or family history of atopy, and here we saw that the father has sinusitis. They often talk of sinusitis, which actually means a constant or a recurrent cold. They use the word sinus trouble for that. For us doctors, the interpretation is that father has history of atopy. So that completes our initial deduction that this child has a airway disease which is most likely atopic in nature. The next question to ask is about the sequence of complaints, because there were multiple complaints here, and we found that it always starts with a running nose followed by a cough, and we also found that fever comes up a little later in the illness. This is important because it means it is not an infection and it is a reactive airway disease, as we discussed. Now, since cough is the chief complaint, we obviously look at the onset, duration and progress of that complaint, and we realize that the cough starts after a cold, continues for 10 to 15 days, and then gradually settles down with some treatment only to recur again. We also realize that the cough is more at night, which is again a feature of reactive airway disease or asthma. Coming to associated complaints, we realize that the fever is very mild and it is not there in all the episodes. So that tells us again that this is not infection, this is not recurrent infection, and therefore based on these 6 questions, our diagnosis for this child on history is reactive airway disease. We obviously need to confirm with examination that this child is growing well. We may find some wheeze in the chest, and then we can decide our plan of action for the future. Okay, hi. So you got your nephew today, right?
Yes.
How old is he?
He is 2 years old.
Okay. And what is the problem?
Actually, he's coughing since last 10 days.
Okay. Any fever?
No fever.
Any cold?
No cold.
Okay. So can you tell me how it started?
Nothing. About 10 days back, he started coughing, and since then he's coughing a lot.
You've taken any treatment for this?
Yeah, we have tried many antibiotics and even nebulization, but it's not helping. He's just coughing continuously.
Okay. Has he had coughs in the past, earlier also?
No, since last 2 years he had not fallen sick.
Okay.
Yes.
So, when it started, just think and tell me, do you think it started slowly or it suddenly started?
So actually, I was alone with him at home. His mother was not there, and for 5 minutes I had gone down, and when I came back, he was continuously coughing.
Okay.
Yes.
And has he been a full-term baby at birth?
Yes.
His weight was okay?
Yeah, normal.
And he's got all his vaccines and all?
Yes.
Fine. Let me see and I'll tell you what to do.
Yes.
Okay? So in this video, we saw that this 2-year-old child has come with the only complaint of significant cough. So it's definitely an airway disease. But there is no past history of frequent coughs or personal or family history of atopy. So it's unlikely to be a reactive airway disease. Now, there's no fever either. So it's a non-infective disease. For a minute, one may argue that this could be the first episode of a reactive airway disease. But when we look at the onset duration progress, we realize that it is a fairly severe cough which has gone on for the last 10 days for the first time. So that's unlike a reactive airway disease. So in such situations, we have to go back to the onset and try to dig for the onset as we have done in this case, and it is then that you might sometimes find out that this was a sudden onset of the cough. Of course, you must look at onset duration progress anyway because it is a monosymptomatic presentation, but this is what will give us the diagnosis of a possible foreign body. Hello Gayatri, how old are you now?
I'm 18 years old.
Okay. And what is the problem?
I'm coughing quite badly since 15 days. I've tried so many cough syrups, but it's not helping.
You have fever also?
Yeah, initially it started with fever for 2 days, and then I started coughing, and since then I'm coughing.
Okay.
Yeah.
Fever was high grade?
No, it was 9900.
Okay. And have you had coughs in the past?
No.
Okay, repeated cough, cold, sneezing in the morning,
No.
sinus trouble, skin
Nothing
itching?
like that. No.
Okay. Okay. And this cough is, can you tell me more about how it started and how it has behaved over these 15 days?
As I said, it started with fever for 2 days, and then the cough start. It comes in bouts. I go on coughing for 10-15 coughs continuously, and I feel out of breath at the end of that.
Okay. And in any particular time of the day when it is more, this cough?
Throughout the day, the cough is there. It only stops when I'm in the deep sleep.
Okay.
Yes.
Anybody in the family has a cough cold?
Yeah, my brother started 5 days before me. and he's still coughing as same way as me. Yes.
Have you taken all your vaccines?
I think I have missed my booster, but otherwise before everything vaccine have been done.
Okay. Let me see, let me just examine you and then we'll see
Yes.
how to treat this.
Yes.
So now this late adolescent girl has come with significant cough as her chief complaint. So it's an airway disease, but there is no past history of frequent cough or personal or family history of atopy. So it's not a reactive airway disease. It did start with some fever, suggesting that it's possibly an infective airway disease. The commonest infective airway disease is a viral infection, but when you look at the ODP of the cough is actually progressive, whereas in a viral infection it would get better in about 5 to 7 days. So this is likely to be an infective airway disease which is different from a viral infection. Further, she said that the cough comes in bouts and she also has a contact in the family. So it's a communicable disease, infective disease, where the cough is in bouts and is progressing over a period of time. This gives us the diagnosis of possible pertussis. Of course, the fact that she has missed her 10-year booster adds to the diagnosis.